From a pharmaceutical standpoint, as it relates to patients that you treat um, within your physical therapy, what's your opinion on our use of day to day diagnosing things and just medicine fixes everything? Do you feel like that we tend to over prescribe to things that could be fixed through more holistic paths?
Oh, absolutely. We're over medicated as a country. The biggest problem is most people don't have either the knowledge or they don't have the grit to do what it takes to change their life.
What are some of the most common things that you see people? And I don't want to give anybody, and I may be asking you to do more than what you should be. I don't want to give anybody the thought that you're trying to say all of this is bad.
Yeah.
But what are some of the more common things that someone could, whether their own medicine, there may be other holistic approaches than to be medicated if they were just doing this, this, and this. What are some of the common things that you see?
Right now, because I've gone through it, when you buy a car, you see that car everywhere. For me, it's just the thyroid issues and energy and fatigue that people have. And if they're not on medications for things, then they're trying to mask it with caffeine. And so, my patients that are relying on caffeine or they're relying on having quick fixes like candy, in their purse or in their car or things like that to give them that quick little hit of energy. Those are the things that I'm like, something's wrong here. Your blood sugar is in this state of dysregulation and your energy shouldn't be like this. So that's the big thing I see is just the energy production.
Where's your long-term vision with this practice? I know that you've got in your business name, collective that's in there. Tell me what that vision looks like.
I would love to just have a business that had other wellness practitioners, like let's say it's massage or functional medicine or even like a FNP. Anyone who's in the practice of helping people feel better, if I could create a one-stop shop for that. And right now we're pretty small, like I only have one other treatment room, but if we continue to grow, I'd love to just create a place that gave other people the ability at a very low stakes level compared to, their own big business at entering their own thing.
We see a lot of practitioners, medical practitioners that are going to work for big corporations, having the, I hate to use the word mom and pop, but having the smaller practices, you don't see it as frequent anymore. And I think that's just a lot to do with the complexity of insurances and being able to have bigger resources. It's the amount of staff you're seeing these people have to hire is substantial just to keep up with the regulations. Do you really see that you could be able to create something on the level you want without having to get big corporation size or having to merge with big corporation? Because I think that there's a lot of value the independence can bring to the table. There's a lot more flexibility you have of being able to treat people than going from a big corporate level. How do you see that with you down the road?
Yeah, I would never merge with a big company. I can guarantee that right now. And just from driving around here and dropping off, business cards to other practitioners, I'm realizing there's other practitioners that have the same vision and goals in mind to do things their way. And a big part of it is as our reimbursement declines across the country with insurance companies, that creates a burden on practitioners. And so that's why we're all exiting the big conglomerates and big corporations, because we don't want to be burned out as healthcare professionals.
Right. But the message I want people to hear is I think there's value, tremendous value, with independent people like yourself.
Absolutely.
Because you have the flexibility to be able to bring the treatment in at the time the patient needs it instead of saying, well, I don't know, we don't have anybody that necessarily specializes in that, or that's not our bread and butter, so
exactly.
we may not want to do that. Where do you see, so When you put together a business, did you put together an official business plan when you guys started this?
No.
Where do you see yourself in a year? So less than 60 days into it, you're pretty much full with the time you've allotted.
Mm-hmm.
Where do you see this thing going?
Well, we have a new physical therapy program at ULM with some awesome students going into their second year. So by next year, they'll be entering their third year looking for clinical placements. So part of what I want to do with the company is help other young physical therapists kind of become masters at their craft and good at what they do. And so just mentoring them, bringing them on for clinicals, and then if the opportunity presents itself and I have available treatment space, then hiring on some new ULM grads to work for our company. And maybe by that time I'll be on maternity leave again, and it'll be the perfect time for them to come on as I take a little break for 8 months.
Yeah, that would be great.